Hi, I'm Susan Hogeland. I'm Executive Vice President for the California Academy of Family Physicians, and I'd like to tell you a little bit about what we've been doing for you and your patients this past week. Well, we had a very busy week. I'm sure yours was too. Our legislative advocate Tom Riley and policy staff stayed very actively engaged evaluating potential last-minute changes to bills of concern to the Academy and following the action on the budget trailer bill. We were quite disappointed to learn this morning that the Healthy Families program will indeed be merged with the Medi-Cal program, which was an action we fought against. Our patient-centered medical home legislation, SB 393, will now be heard in the Assembly Health Committee on July 3rd instead of June 26th. So there's plenty of time for you to contact your Assembly member if he or she is serving on the Health Committee and to ask for support of SB 393. Our website has talking points to help you with that, or we'd be happy to help you to kind of talk you through that whole process if you want to call us on the phone or email us. Also on the patient-centered medical home front, we testified on AB 2266, and we encouraged the Health Benefit Exchange in a meeting with Peter Lee, the Executive Director of the Health Benefit Exchange, to include PCMH in health plan offerings that will be available to California consumers in the future. We fought for quality of care in opposing SB 1524. Dr. Ron Mabugan testified on the Academy's behalf in the Assembly Business, Professions, and Consumer Protections Committee last week. This bill would remove the 6-month physician supervision requirement for newly graduated nurse practitioners and certified nurse midwives in the furnishing or ordering of drugs and devices. We'd like to keep that 6-month supervision requirement. We held a call with AAFP staff members to tell them about what we've learned about new health plan offerings from Blue Shield of California and WellPoint and Anthem that pertain to the patient-centered medical care and providing incentives to patients to obtain preventive and primary care services. We learned from IBM about an amazing new product they're bringing out to assist physician practices in becoming more patient-centered based on their Watson technology. It is truly remarkable technology. Also on the patient-centered medical home front, Leah Newkirk and I traveled to Fresno on Wednesday afternoon to be present for the Board of Education's vote on the Enhanced Primary Care Project, which was proposed by the Joint Health Management Board of the Fresno Unified School District. And that project passed unanimously, which means that it is now fully funded and physicians will get per member per month payment for providing PCMH services. We've really enjoyed working with the Joint Health Management Board and community medical providers, which is a group of primarily family physicians in Fresno, on this project to test the PCMH model. Leah spoke to the Joint Health Management Board on Thursday morning about accountable care organizations, and in the afternoon she and I met with Dr. Grant Nakamura, who is Community Medical Providers Medical Director and a family physician and a member of the Academy, to discuss some project details. We are absolutely delighted with the progress of this project, and we would like to thank the physicians and the staff members at Community Medical Providers for their enthusiasm and support for the project. I really want to thank Dr. Adriana Padilla, a former member of our Board of Directors, for all of her support and help on the project. We're continuing our preparations for our 2013-15 strategic planning meeting, which will be held at the end of July, doing our environmental scans and updating our final action report for the board on the 2009 to 12 plan. And I think that's it for now. So I hope you have a great weekend. I look forward to speaking with you again next week. Thank you for listening.